Hi, my name is Leonard. I'm student ID number 3345462, and this is my AVMA task video for veterinary nursing care, VTHT 2439-33430. All right, so I've got Grace with me here today, and she's gonna help me show you how to do a heart auscultation. So the first thing I'm gonna do is I'm gonna go ahead and get her beats per minute. So what I'm gonna do is I'm gonna listen to her heart for 15 seconds at a time, and I'm gonna multiply that by 4 to get her heart rate. Hey, baby. All right, so it looks like her heart rate is about 120 or so. And then the next thing that we're gonna do is we're gonna go ahead and listen to what they call the PAM. So it's the pulmonic, aortal, and the mitral valve. And those are on her left side, so we're gonna give those a listen. And that's gonna be right at that, behind her elbow at that axillary region. So I'm gonna listen for about 20 seconds in each area. I want to make sure everything sounds nice and crisp. Let's see, a couple pairings. I want to make sure I'm not hearing any murmurs, which would be like a swooshing sound. I want to make sure I'm not hearing any arrhythmias, which is going to be her heart rate speeding up when she breathes in. No dysrhythmias, which would be an erratic heart rate. And everything sounds pretty good over here. Hold on, baby. I'm gonna listen on her right side at her tricuspid valve. Make sure everything sounds clear over there. Watch. All right, everything sounds good. Now I'm going to go ahead and palpate her femoral pulses while listening to her heart and make sure that everything matches up. I want to make sure that I can feel her pulse evenly as well as hear it at the same time, and this is going to be looking for any pulse deficit. Can you show that I'm got my hand over here? Come here, right here. Oh, there we go. Everything feels and sounds good there. All right, so the next thing I'm gonna do is I'm gonna go ahead and do a lung auscultation. We just wanna make sure that her lungs are sounding nice and clear. She's got 9 quadrants. So we're gonna listen on each side. It's gonna be about 1, 2, 3, 4, 5, 6, 7, 8, 9. And we're gonna listen to all 9 on each side. Hey, baby girl. We're gonna be listening for a stridor, which would be a high-pitched wheeze, a stertor, which would be a low-pitched kind of a snore, and then maybe some crackling, which might indicate something like pulmonary edema. But ideally, what you wanna hear is a whole lot of just breathing. You wanna make sure that you hear nice, clear lungs. So we'll go ahead and start. And you want to listen for about 2 solid breaths for each quadrant. Okay, everything sounds clear on this side. Hold on, baby. I'm gonna come over here. I'm gonna go. Not hearing any abnormalities so far. And now I'm just gonna go ahead and listen at her trachea and see if there's any upper airway abnormalities. hear any wheezing or anything abnormal? All right. And so I would say overall, Breeze here had a really normal heart and lung auscultation. All right, so I'm going to demonstrate how to use a rabies pole today. So we have a tension pole, and so what that means is you're going to take your loop and you're going to go ahead and extend it around the pet's head and neck. And then once you're around their neck, you're going to go ahead and pull the string and tighten it. And you want to make sure you tighten it so it's at the base of their head. You want to make sure you stay on the back side, and you can use that to move the pet around wherever you need. When you need to release it, you go ahead and you just twist and pull on this little knob, and that's going to release it. If you notice that your pet starts flailing and flipping, or if they're in distress, you want to make sure you definitely release as soon as possible. You don't want to cause them any harm or make them unable to breathe. You would use a rabies pole on a suspected rabies patient. You also can use it on an extremely aggressive patient that you don't feel comfortable getting close enough to. If he just seems like he might be a hazard, you can go ahead and put this on him. You can guide him around, pin him against any walls if you need to administer any injections that you may need to. So now we've got Nola here. We'll go ahead and take her off her leash. All right, so what we're gonna do is we're gonna go ahead and loop this around her head. She's sniffing. There we go. And I'm gonna go ahead and pull my string nice and tight. It's at the base of her head. Now I'm gonna make sure I stand behind her, and I can use this to guide her anywhere I need her to go. You always wanna make sure you're at the back side, that way she can't turn around and nip at you. Once you're finished with anything you need, you're gonna go ahead and release, let go, and slide it off her head. And that is how you use a rabies pole. Okay, so I'm gonna demonstrate how to properly clean a cage. So what we use in our hospital is we use diluted Kennesaw solution. We've got our label right here. And so what we're gonna do is we're gonna spray all 7 sides of the cage. So that includes the top, the bottom, all 3 sides, and the front and back of your cage door. So I'm gonna go ahead and get those sprayed. Alright, and then per the directions on the Kennesaw, you want to let that sit for 10 minutes. So we're going to go ahead and set our timer. I've got one right here. Set for 10 minutes, and we're going to go ahead and start. Alright, so there goes our timer. That just went off, so it's been 10 minutes. So now I'm going to go ahead and spray the cage one more time, all 7 sides, just to help loosen things up, break them up a little bit. And then I'm going to start cleaning the cage from top to bottom. All right. And do my bottom, the bottom side last, just because the pet has the most contact with that. I don't want to spread anything around to all the other sides. Make sure we get all those corners really well. Okay. Now I'm going to do our cage door. Also going to make sure that we have enough on our handle. that is how you clean a kennel. Okay, so I'm going to demonstrate how to perform an anal gland expression on a dog. So you want to make sure you have all of your necessary supplies. This is going to be gloves. You want to make sure you have a lubricant, some paper towels to clean up your mess and catch the anal glands. And you want to make sure you have something to clean your dog up with. So I'm going to go ahead and put some lubricant on my index finger. And I'm going to go ahead and insert my finger into her anus. The anal glands are going to be around 5 and 7 o'clock. And so what I'm going to do is I'm going to go ahead and use my thumb to assist in milking it. The anal glands are, well, it's okay. Depending on the size of the dog, they're generally like a small grape size. Go ahead and milk those out. Good job, pretty girl, you did great. And then we're going to go ahead and clean her up. So the consistency of most anal glands when they're normal are going to be about corn oil consistency. And so that's what you're looking for. And hers were normal contents. They express easily. And I would say they're mildly full. There wasn't a whole lot in there. So now I'm going to go ahead and just clean her up. So I've got some waterless shampoo here. I'm just going to spray it all around. Make sure we get her nice and clean. Make sure she smells good before she goes home. There you go. And that is how you express anal glands on a dog. Okay, so this is Missy. We're going to go ahead and apply her topical ointment. So this is Revolution Plus. So we're going to to open it up, we're going to push the cap in to pop a hole in it. And that should puncture the top. And so what we're going to do is we're going to go ahead up, kind of near her neck and her shoulder blades. We're going to part her hair. And we're going to put contents of the entire tube on there. I like to put it in different spots just to make sure it gets evenly applied. Get that all on there. And you want to make sure that you go up high where she's not able to reach it or to lick it. It could cause her to hypersalivate and to just be uncomfortable. So we want to make sure that we get it where she's less likely to reach it. And that is how you apply a topical medication to a cat. All right, so this is Pepper, and today we're going to be cleaning her right ear. So I'm going to go ahead and open up my Epiotic Advance. This is my cleaner. And I'm going to go ahead and lift up her pinna. That's going to help straighten out her ear canal. I'm going to go ahead and just kind of pour some in your ear canal until it kind of overflows a little bit. There we go. And I'm going to massage down in there. I made sure not to get the tip of my cleaner in her, touching her ear and her canal, as that could spread some contaminants. And then we're going to grab some cotton gauze. I'm going to go ahead and wipe it out. Just really gently wipe inside her canal. You want to wipe it until it comes clean. You can see that there's some debris on there. If you do notice any purulence or any bleeding, you want to make sure that you bring the attention of that to your doctor, and you want to stop cleaning as soon as you see any bleeding. It'll cause some more irritation. All right. So go ahead and have a little bit more on there. We'll do a little bit more. I'm also going to go ahead and just pour a little bit of cleaner on the gauze itself. Okay, pretty girl. All right, that's pretty clean. So now I'm just going to take a couple of our cotton tip applicators, and I'm going to go ahead and put a little bit of, there we go, a little bit of the cleaner on those, and I'm going to use that, lift up her pinna again, to get in these crevices, just those tight little spaces where it's a little bit harder to get with your finger and with the gauze. So we'll just keep doing that until that comes clean. What a good girl. That's a good one. We got a good little bit out of there. All right, Pep, you're doing great. All right, a little bit more, baby. All right, and that's pretty clean. So now kind of massage that out. If she wants to shake her head, we'll let her kind of shake out any extra fluid that might be in her ear. There we go. All right, now that she's done that, we're going to go ahead and apply our ointment. And so we're going to go ahead and, per the doctor's instructions, we're going to remove the cap. I'm going to lift up her pinna and put that tip down. I'm going to give it 4 good squeezes. 1, 2, 3, 4, and lift it out. I'm going to go ahead and massage that ear canal. That's going to help it work its way down in. And we're going to try to keep her from shaking her head for a couple seconds so that way it can start working its magic. And that is how you clean and medicate a dog's ears. So this is Ollie, and today we're going to clean and medicate his right ear. So I'm going to go ahead and take a cotton gauze, and I'm going to pour solution directly onto my cotton gauze. I'm going to lift up his pinna. I'm going to go ahead and use my finger to gently wipe down in his ear canal. I'm going to wipe it until it comes clean. I'll go ahead and get another one. There you go, buddy. Make sure to do it really gently. If I notice that it's starting to bleed, I'm going to stop what I'm doing because that could cause additional irritation. I'll do it one more time. There we go. Getting that all cleaned out. Now, just to get in those additional crevices down there that my finger can't reach, I'm going to take some cotton tip applicators. I'm going to go ahead and saturate those with a cleaner. And I'm going to use those to go ahead and get in those crevices. I'm going to do that until they come clean. That's a good one. But almost done. Alright, that's pretty good. So now if he wants to shake his head, we can kind of let him shake a little bit. There we go, get all that excess fluid out. And now we're going to go ahead and apply some Tresederm in his ears. So I'm going to go ahead and per the doctor's orders, we're going to do 3 little drops in that ear. So I'm going to put that pinna. I'm going to go ahead and get in the canal and go 1, 2, 3. I know it's hard to see, but there's our 3 drops. We're going to massage it in there. We're going to let him sit for a couple seconds. Alright, and that is how you clean and medicate a cat's ears. Okay, so I'm going to demonstrate how to perform a nail trim on a dog. So my restrainer Jackie is going to hold her in a position that's appropriate for a nail trim. So she's got one arm under the abdomen and she's got the next up by the jaw. She's going to make sure that she's not pushing on the throat so she doesn't affect the airway. So what I'm going to do is I'm going to pick up the foot and I'm going to lift it under. That's going to give me the best view of the nail and the quick. The quick is the vein with blood vessels and nerves inside of the nail. You want to avoid quicking that if at all possible. If you do cut that, it's really sensitive. It may bleed. Long-lasting results may be hesitation to get their nails cut in the future. It could be infection. It could be long-lasting pain. And so when you clip the nails, you want to clip until you see the quick. On white dogs, or on white toenail dogs, it's a little bit easier. You're just going to clip off the white part, but make sure you don't clip the pink, as that's where the quick is. For darker nail dogs, it's a little bit more difficult. You want to kind of shave just a little bit off as you go, and you're going to kind of look for a bullseye center. So it's going to look like a meaty bullseye center right in the middle of the nail. So I'm going to go ahead and get that started. So I'm going to lift her foot backwards. I got it. Here we go. And you see the pink portion right there, and there's the white part. I'm going to cut right before I get to the pink. So we're going to clip 1, 2, 3, 4, and she's got a dew claw up here. All right, let's try that one again. There we go. All right, and I did not quick her. However, if I did, I would take some of our quick stop. Hey, buddy girl. I'm just going to put a little bit on the tip of my finger, and I'm going to firmly press it on the end of the nail where it was quicked. I'm going to hold it there for just a couple seconds, wipe off any excess quick stop, and that's how you trim a nail on a dog. I'm going to demonstrate how to perform a nail trim on a cat. So this is my restrainer Lauren, and she's going to kind of scrub her and put her on her side, and then I'm going to lift her paw backwards, and that's going to give me the best view of her nail and her quick. So the quick is the vein inside of the nail, and if you were to cut that or quick the cat, that's going to make it bleed, and it's also going to be pretty sensitive. They have a nice little hook on their nail, and that's right where you want to cut. The clear nails are pretty easy because you just cut the white part or the clear part. You don't want to cut that pink part because that is the quick. If you did quick the cat, some long-lasting results could be lasting pain, it could be infection, it could be hesitation to get their nails trimmed in the future. So I'm just pushing on her paw pad, and that's exposing her retractable nails, and just clipping the nails right at that curve. And so if I didn't quick her, but if I were to quick her, I would take a little bit of quick stop,
And what you do is super easy to apply. Sorry, that one was not open. And you're just gonna take a little bit on the end of your finger, and you're gonna push out the claw that you quicked, and you're just gonna firmly apply it with your finger to the tip of the nail, and hold some pressure on there for just a second, and then clear away any extra powder, and that should clot the blood, and you should be good to go. So that's how you perform a nail trim on a cat.
Alright, so I'm going to demonstrate how to pill a dog. So you're going to make sure that you have all of your necessary supplies. This is your dog and of course your pill. However, this little baby is not on any medication, so I just have a little dog treat that we're going to use. So first you're going to go ahead, you're going to put your non-dominant hand on the top of their mouth, and then you're going to use your dominant hand with your pill between your index finger and your thumb, and you're going to use your middle finger to pull down their jaw, push the pill back as far as you can, close the mouth, and massage the throat. That's going to encourage them to swallow. And once you see that swallow and you see the dog lick, you know that the pill has gone down the throat successfully and they're not going to spit it back out. Okay, so I'm going to demonstrate how to pill a cat. First, you want to make sure that you have all of your necessary supplies. So this is your cat and of course your pill. However, this little kitty is not on any medication right now, and so we're just going to pill him with a little bit of a cat treat. And so what you're going to do is you're going to hold the cat's head in front of their ears, and lift their head backwards with your non-dominant hand. Then with your dominant hand, you're going to have your pill and between your thumb and your pointer finger. You're going to open their jaw and put the pill back as far as you can. You're going to close his mouth and massage his throat to encourage him to swallow. So I'm going to do that until you see that nice little swallow. And then we'll watch him lick. And now that he licked, we know that he swallowed it and he can't spit it back out. And so that's how you pill a cat.